I started at 200, went up to 250, and it just escalated.
We were very naive and we didn't know what really addiction was.
All of a sudden my father shows up out of his mind. This basically took away his life.
It takes over your life.
Yeah,
the opiates take
really
over
did.
your life.
We have 4% of the world's population in the United States. We consume 80% of the world's opioids. We have an epidemic of opioid addiction in the United States.
Among the millions of Americans who misuse or are dependent on prescription medicine, a growing number of them are seniors. 68-year-old Betty Van Amberg was one of them.
It kind of snuck up on me.
Through 20 years of back pain, she saw general practitioners, orthopedists, pain specialists. Each time it was the same.
There's a constant changing of medication from the pain management doctors. If you say your pain is worse, they either add something else or they change what you're taking or elevate the amount.
Before Betty or her husband Fred knew what was happening, she was addicted. Hydrocodone, Xanax, even patches laced with fentanyl, a narcotic up to 100 times stronger than morphine.
I was sleeping all the time and I was almost a zombie.
She was too foggy to drive. She grew isolated and distant from her friends and family. Her desire to get help led her to Dr. Mel Pohl at the Las Vegas Recovery Center.
The real problem with these drugs is that they stop working effectively. Most people, more than 70% of people who are on these drugs long term, are not getting the benefits they got when they first start them.
Dr. Pohl says as patients grow tolerant of the drugs, oftentimes doctors are too quick to simply prescribe more.
I don't think there are villains in this for the most part. I think that doctors are trying to help patients suffer less. I think patients want not to suffer, but these drugs are not the solution. They're just simply not the solution.
Despite a push by public health officials to cut dispensing rates, doctors are giving older patients more of the highly addictive drugs than ever. The government estimates that about 336,000 seniors have misused prescription drugs in the past year, a jump from 132,000 just a decade ago. Adding to the problem, older brains and bodies are especially vulnerable to drug complications.
He suffered 7 falls in 12 days. He suffered dehydration again. His kidneys started failing. His heart started failing. He contracted a MRSA infection in his eyes that spread to his chest, all within 12 days.
Marion Hollingsworth's father, Keith Blair, was hospitalized in his mid-80s while suffering from back pain. While he was there, she says doctors layered a powerful antipsychotic onto a mix of opioid painkillers.
As far as we knew, he was under his own faculties and could sign his own papers, and 4 days later, he was out of it. He was completely out of it, and the doctor wrote me a letter saying he was no longer able to make his own decisions.
Over the following weeks, Blair remained semi-conscious as he bounced between 2 hospitals and a nursing home. He continued to decline until his heart and kidneys failed completely. Blair died without returning home.
I would say know your rights, that if you are the power of attorney for this loved one, you need to ask questions.
Both Hollingsworth and Van Amberg say that is a patient's best defense, to ask questions.
Always do what you think is best for you. You have to be your own advocate. You can't expect other people to advocate for you and to do for you what's right, because they don't always do it.
As for doctors' roles in curbing the problem, Dr. Pohl says the key is education.
I think prevention, which is really never starting these drugs and having a sort of shift in our consciousness to what do we do about chronic pain, is really the long-term solution. But I think that as an undertaking culturally, that's going to be a real challenge.
We got Tylenol. That's what I use now.
We're looking forward to what is going to be in the future.